Hey everyone. So today I have the pleasure of talking with a beautiful human and healthcare provider all about breast cancer and her personal experience with it. Courtney Fiore is 37 years old. She lives in Mass with her husband and three boys, ages 6, 4, and 2. She has been practicing as a PA for over 12 years with extensive surgical training. And for the past 6 years, she's been in a dermatology private practice in Mass, focusing on adult and pediatric medical and surgical derm. She works closely with the Tufts PA program as a preceptor for PA students interested in dermatology elective rotations. She's been previously awarded a Partners in Excellence Individual Award from Brigham and Women's Hospital in 2013 in recognition for outstanding performance and commitment to excellence, which doesn't surprise me in the least. At the age of 36, so last year for Courtney, she was diagnosed with stage 3 breast cancer. She has no family history of breast cancer. All of her genetic testing was negative. She proceeded to undergo a double mastectomy, 3 months of chemotherapy, and 25 rounds of radiation, followed by reconstructive surgery nearly 1 year after the initial mastectomy. She's currently in a medically induced menopause on targeted endocrine therapies for an expected 10 years, which includes daily pills, Lupron injections every 4 weeks that she goes to Boston for, and a specific type of infusion that she gets every 6 months at least for the first 3 years. Fortunately, currently, she is disease free. She has been strong enough to share her story and use that to educate women on the importance of things like regular self breast exams and strongly encouraging women to advocate for themselves. So, take a listen to her story and some pretty powerful messages. Welcome to the Lifestyle PA podcast, where we talk about all things women's health and lifestyle to help you become the healthiest and happiest version of yourself. All right, Court. So thanks so much again for joining us today. So can we just start by you just kind of telling everyone like a little bit about your story?
Sure. So I actually found a lump doing a self breast exam when I was pregnant. Initially during third trimester, your body just goes through so many changes. This is my third pregnancy. And so initial gut reaction was like, is this just a little clogged milk duct or a cyst or something? Brought it to the attention of my OB at my next regular visit. And just out of an abundance of precaution, she said, I really don't think this is anything, but let's just get an ultrasound to check it out. On ultrasound, they did see not a cyst. It was a solid hypoechoic mass, about 5 to 6 millimeters in size, but had very benign features and findings. And so the radiologist at that time was like, this looks probably benign. It looks like a fibroadenoma, which is a very common hormonally influenced growth. You're too young and you're too healthy for this to be anything scary or dangerous. You have no family history. And so they decided that it was in my best interest to not biopsy the lesion and instead just monitor it. We did a mammogram that day just for further characteristics, and they did not actually see anything on mammogram because of the density of my breast tissue. And for me, there was that initial reaction like, really pushing like, should we biopsy this? Because I, as a healthcare provider myself, I know that there are some faults within just human error and looking at things at face value. But there were multiple people across the time that said, we don't feel that the benefits outweigh the risks. It can cause a lot of issues with your milk coming in and infection and all of these things. So let's just have you come back after you have the baby. So I had my son Drew maybe 4 or 5 weeks after that initial imaging, and I went to go back for follow up probably 3 or 4 weeks postpartum. At that time, my milk had come in. My breast composition was very, very different from the initial presentation to a point where they couldn't see it at all, even on ultrasound. They were imaging like that whole area where they had marked where it was, and nothing really showed up. So they said, this is beautiful, just what we expect with a fibroadenoma. Let's have you come back in 6 months and we'll recheck it. I went back 6 months later. And, it was just kind of this song and dance that we did. And so we ultimately watched this thing for a year and a half. Some days we could feel it, some days we could see it. But on the times that they did see it on ultrasound, it was stable and unchanged compared to the initial presentation. And so every step of the way, I was asking, should this be biopsied? And repeatedly was being reassured that this is nothing. You're too young, you're too healthy. This doesn't look like cancer. You have no family history of cancer. We have no reason to believe that this is anything of any concern until I stopped breastfeeding. And so I went back for my routine scheduled ultrasound and mammogram in September of 2023. And at that time, they saw that same little 5 to 6 millimeter smooth ovoid mass, and right adjacent to it was a 1.4 centimeter firm fixed spiculated mass, meaning it was kind of spiky, looked very irregular. And at that time, the radiologist said, well, thank goodness you had this very benign finding that kept you coming in so regularly, because now we happen to see this other spot that is separate, unrelated. This looks concerning. Come back tomorrow. We're going to biopsy this spot. And I just knew in my gut, like once I saw it on the screen and having those conversations, that like this, I knew that it was cancerous. I went back the following morning. They biopsied that area, and 3 days later, I was notified. I read the results myself on the portal because I got the notification that they were published. It was a Saturday morning. And so I just felt like my world kind of crashing down around me that weekend. I will say I had a very supportive OBGYN who was the ordering provider on all of those imaging scans. And she actually reached out to me that Saturday night at like 7 p.m. just to check in on me because she saw the results and she assumed that I had as well. And just kind of got the ball rolling with, let's work this up. We knew it was cancerous, specifically an invasive lobular carcinoma, which lobular carcinomas aren't as common. Most breast cancers are ductal carcinomas. Lobular is it's different. It grows in the lobules, not in the ducts. And so think of it as like the little area that I was palpating, the spot I was feeling was almost like the center. And then it had these like long stringy tentacles that kind of grew out in straight lines. And what makes it hard is that invasive lobular carcinoma oftentimes does not present in the same fashion as ductal carcinoma. It's often missed on mammograms, missed on ultrasounds, until we got the MRI of my breasts and really saw how extensive that was. The initial spot that we were feeling and watching was in fact connected to that spiculated mass that was biopsied, and it was just tip of the iceberg. I mean, my final size based on the MRI and then ultimately with the pathology, my tumor essentially was between 5 and 6 centimeters, kind of start to finish, and it was present in all 4 quadrants of my breast tissue. I did have a double mastectomy, and unfortunately with that, the margins were positive, meaning that those cancerous cells abutted up against the edge of where my breast tissue was. There were a lot of discussions with my team. They presented my case to the tumor board at Dana-Farber, so there was sort of a meeting of the minds to kind of decide, well, what are the next best steps? This was a fairly atypical presentation. The surgeons felt very strongly that all of the breast tissue had been removed and there was no gross abnormality left behind, but because there were sort of multifocal areas where there may have been some rogue cancer cells left behind, ultimately I went forward with 3 months worth of chemotherapy and 25 rounds of radiation to the entire left chest wall, just to obliterate anything that may have been left behind. In addition to that, what makes breast cancer so unique is that everybody has sort of an individualized presentation and treatment plan based on hormone and HER2 protein receptor status. So they test each tumor specifically to see which receptors are present and what it is that is specifically feeding that tumor, and how do we prevent that from recurring. For me, I was very strongly estrogen and progesterone positive and negative for the HER2 protein. And so, because of that, really the mainstay of my treatment and recovery is now focused primarily on these endocrine therapies, really targeting the blockage of estrogen and progesterone. So, in doing so, we have put me into a medically induced menopause, which, at 36 years old, to all of a sudden have hot flashes and joint pain and insomnia and all of those traditional menopause symptoms as an abrupt halt to your system, is, frustrating in and of itself. Um, so in order to do that, I do go into Boston every 4 weeks for an injection of Lupron that really kind of shuts down my ovaries. I take a medication every day called letrozole, which also sort of blocks that hormone receptor status within my body. So both endogenous and exogenous estrogen, places that are secreting that, not just from the hormone, from the ovaries. And I also take a medication called Kisqali or ribociclib, which inhibits CDK4 and 6. And the thought process behind that is that CDK4 and 6 is something that is necessary for cancer cells specifically to multiply, divide, and continue to grow. And so by taking this medication, it also kind of stops and slows that process. Hopefully, any cancerous cells go into sort of a dormant or sleeping phase, and then induce apoptosis, where the cells just sort of die off over time. All of those are really aimed to decrease my risk of recurrence over time. And so that's a 10-year plan, that I'll be on these medications and just continue to follow regularly. In addition to that, I still go in every 6 months for an infusion of Zometa. Zometa works to really strengthen my bones. Because I'm in a premature menopausal state, it really helps with overall bone strength and density. But there are actually some studies that show patients who have received Zometa also have a decreased risk of overall cancer recurrence, not just in the bones, but sort of globally as well. And so that was something that my oncologist felt pretty strongly is an important step in the process.
You are such an incredible, strong person. And obviously, words can't describe how sorry I am that you had to experience all of that. So many scary parts that you just shared, right? Because even going back to the beginning of your story, like, say you weren't a PA, say you weren't in the medical field. It sounds like to me it was just found on self breast exam, which honestly, how often are women actually performing those routinely, right? And I feel like that's the only way you caught it so early because like you said, there is no family history of breast cancer or significant cancers that are related to it. And as far as other risk factors, the biggest risk factor other than family history is really the one that's tied to it is being overweight, just because of that excess fatty or adipose tissue, especially around the belly, produces more estrogen, and that's what can increase the risk. You didn't have that either. So that is just, if there's one takeaway from today, I think there's many, um, it's performing those self breast exams. And can you tell us a little bit about when should you do it? Like during what part of your cycle? Can you tell us a little bit about that?
Yeah, I think honestly, what's most important is knowing what your normal is. And so get familiar with your body, touch yourself in the shower. It doesn't have to be this long and uncomfortable thing, but just as you're washing, just do a quick exam. I think it gets really difficult when you're telling people like a specific task that they have to do. Sometimes it feels kind of daunting and overwhelming. And I can't tell you how many women I have talked to that say, like, well, I was never really told how to do this or what to look for. And so I think just as a basic conceptual understanding, feel it on the first of the month, every month, just have that be your regular reminder when you're in the shower, arm up and just kind of palpate around, using the pads of your fingers. Just get familiar with your normal density. Breasts oftentimes do have little lumps and bumps and quirks, and that can be very okay and normal. But what you're really feeling for is something that jumps out at you as distinctly different. Mine felt almost like a pea or a marble that was sort of on the outer side of my breast. The outer aspect and towards the armpit is actually the most common place that those things can present. It's also important to just look at the skin. Is there any redness, any change in texture? Is there any weird discharge or blood coming from the nipple? Is the nipple starting to invert? Just really knowing you're normal and then advocating for yourself if you feel like there is something that needs to be evaluated further.
For sure. I think that is the other biggest takeaway is, and again, you're in the medical field. Like we are aware of this stuff. We know this stuff. The majority of women don't know those things to look for and don't know what's abnormal or when to push. A lot of us, understandably so, trust our providers to be like, yeah, that's it, fibroadenoma, like that's benign. Let's just recheck. This is your body though. Like you said, get familiar with your baseline. You know your norm. If you know something isn't right, push to get checked. Like what if you hadn't done that and truly advocated for yourself, right? And if you're not satisfied with your provider not pursuing further diagnostic tests or biopsy, get a second opinion. This is your life, and you're absolutely right. You have to advocate for yourself through and through. Now that not only have been through this experience, you continue to live with it day to day, but knowing what you went through, and now that we talked about some ways that you can screen yourself, for those women who can decrease their risks and modify their lifestyle behaviors, what would you recommend for a couple of simple changes where they could decrease their risk of going through this similar experience?
Yeah, I mean, I think it's really daunting when you look at overall some of the toxicities and environmental exposures that we're exposed to on a day-to-day basis. And so I'm a big advocate for just everything in moderation and progress, not perfection, right? Like making small changes that are sustainable and not looking at this overall huge picture where you need to like move and live in a bubble and protect yourself from everything. For me, there are two main, I'd say, biggest things that I have changed. Number one has been my relationship with alcohol. Alcohol is a known class one carcinogen. I was somebody who was very social, and every time there was a gathering or something, I would have a glass of wine or go out for drinks with friends. And I, I think for me, when that really changed was when I had surgery and going through chemotherapy. Quite frankly, it was that nothing tasted good. And that has sort of continued in the fact that I don't feel good. I almost wake up every morning feeling hungover. And so not wanting to exacerbate that has played a huge role. In the fact that I very rarely consume alcohol anymore. I don't want to say never because certainly some things need to be celebrated. There are birthdays and there are milestones and holidays, and sometimes you just need to celebrate little wins in life. And I still do enjoy a glass of wine every once in a while. But certainly my relationship with alcohol overall has changed. another thing is really kind of focusing on moving my body and focusing more on some strength training. I've always been someone who has been in good shape and took care of myself. Certainly in my 30s, having three babies within 4 years, life gets a little bit busy, and maybe my focuses had kind of shifted, and I was doing a little bit more, you know, just day to day chasing the kids around, or try to go to a bar class or a spin class when I was able to. And I think what I've really honed in and focused more on is some strength training exercises, which I think is just so important if you really look at some of the research and science behind all of that. Um,
So important, even when it comes to alcohol, because I do see a glimpse of a positive shift overall, especially with our generation, realizing that, hey, there is actually research showing this is cancer causing, and here we are, right? But as you mentioned, and I share a similar philosophy, and achieving that balance is really what helps to keep those behaviors sustainable. So you're now in this medically induced menopause, and you don't have the option to go on hormone replacement therapy. Like that's why you're on this. You can't supplement with the estrogen that's naturally lost or the progesterone or the testosterone. So you mentioned briefly a little bit about the joint pain and difficulty sleeping. Can you walk us through a little bit more of those symptoms and then maybe what you have found that has helped to improve them even a little bit?
Yeah, absolutely. I think for me, what was most prevalent from the get-go was the hot flashes. And it's not just, I don't know, I think I just envisioned menopausal women in general, like, oh, they just get a little hot and flushed and that's it. It's this very strange sensation where I can almost like feel my ears really getting hot and flushing first. And it's like this full body internal inferno that gets so hot, and it's very uncomfortable, particularly at night when you're trying to sleep. It can be really disruptive. And then as your body is kind of coming down from that with the vasomotor response, then you're almost like shivering and you get really cold. And so that has been something that was really difficult for me because I found it very disruptive to my sleep, which also then had a whole downstream effect as well. Um, my poor husband is used to it at this point, but my ceiling fan is on every night, all night. I do a lot of kind of tossing and turning, and blankets on, blankets off, windows open a lot, which, in December in Massachusetts is not always ideal. Um, but that is just something that I've just kind of come to live with. I actually, for the summertime when we would be out and about and it was really warm, I actually have a neck fan that I got on Amazon. Highly recommend for anybody who deals with hot flashes. It's pretty quiet and it just blows air kind of up your face, which was really helpful. Um, I will say the joint pain for me is most prevalent first thing in the morning. It takes me a little while to kind of get moving, especially in my fingers more so than anything. I have a little bit of a trigger finger that kind of locks and gets stuck, most significantly first thing in the morning or late at night when I'm really tired. But moving my body by far has been the most important thing. An object in motion stays in motion. And I find if I have a string of days where I'm really not feeling well and I'm just kind of like laying on the couch and not moving, it almost exacerbates all of those feelings. And so it's really important to kind of prioritize the movement in some way, even if it's just minor.
Perfect. So now, on a personal level, because unfortunately, I think breast cancer is so prevalent that the likelihood of one of our listeners knowing a mom, a sister, a friend, a cousin, someone in their network who has gone through that journey, what can we do to best support other women going through that? Like, were there certain things that you found really helpful when you were going through this journey? And if so, can you share some tips for us?
Yeah, absolutely. I think breast cancer has become so prevalent. The statistics show 1 in 8 women will be diagnosed with breast cancer, and it's actually on the rise in younger premenopausal women for reasons that we don't really understand yet. For me, I think what was most helpful was feeling so supported, just reaching out with a phone call or a text message or a card or a message on social media, just really feeling like I had a huge village of support far and wide. That to me was the most meaningful. Feeling like I had everybody pouring out. I really believe in like big energy and the power of prayer, and I that really meant a lot to me. People that had come out of the woodwork that I hadn't talked to in years and years and years, just reaching out and offering condolences and feelings of support was huge. On a more tangible level, my work office kind of all chipped in and got me some house cleaners for the period of time that I was out of work, and that was hugely helpful. Cleaning was always something my husband and I always just did. We never paid for any services because we have 3 little boys, and it was almost worse to have to like clean up the toys and clean up the mess so that the cleaners could do their job. So we always just did all of it. But that has been tremendously helpful, and actually a service that we have continued to keep up with usually they come every other week at this point, and it just is nice to not have to have that also weighing over us. When I was going through chemotherapy, I actually found it really therapeutic when I was sitting in the infusion chairs to color, like adult coloring books and colored pencils and markers. It was just something that I needed to distract my brain, but something that was also just kind of, I didn't have to like really pay a ton of attention and like exacerbate my brain when I was on, IV Benadryl and steroids and Ativan and kind of in this like loopy phase, but couldn't really fall asleep because of complications and allergic reactions that I had to the medication required me to kind of stay awake. So that was helpful for me. And then certainly, just overall donations and gift cards, especially for food and DoorDash and Grubhub and different things when, the last thing I wanted to do was cook or clean or any of those things. So it was just those things I think were most beneficial for me during that time.
Yes, those are all super helpful tips. Thank you. Um, so I think anything else that you want to add or throw out there?
I think what's most important is, like I said, just know you're normal, advocate for yourself. And this goes to all aspects of your body, like nobody knows your body better than you do. If something in your gut is telling you that like something is wrong or something just feels off, like you keep going and get another opinion and talk to anybody who will listen until you feel satisfied with that. I think that is just really important to just that advocate for yourself. And
Yes.
also just don't ever have that mentality that like it can't happen to me, because your life can completely change in a matter of an instant. And so just try to enjoy all of the moments, big and small, but really it is the small ones that really matter most.
I love that. And thank you so much for sharing all of this, Court, like from the bottom of my heart. Um, I really, really appreciate your time and all of the information and just personal experiences that you've gone through. And like we were talking about, yeah, if it helps even one listener, worth it. So I am going to put Courtney's Instagram in the notes of the episode. So if you do have any further questions, you want to reach out just for some advice or someone to talk to, feel free. She is an amazing human, an amazing healthcare provider. And I thank you so, so much.
Thanks for having me. Like you said, if it helps just one person, my job is done. Thank you.
All right. Thanks, everyone. See you next week. If you're ready to invest in yourself to become the healthiest and happiest version of you, head over to my website, thelifestylepa.org, to learn more about my 3-month lifestyle program, where I offer a very personalized, whole body approach to optimize your health. In addition to your 1-hour initial consultation, we have 30-minute bi-weekly Zoom visits. You receive my 45-page lifestyle handbook, lab work interpretation, unlimited communication and support through a secure messaging platform, 3 months of meal plans tailored to your needs, and guidance on mastering the 6 pillars of lifelong health: nutrition, movement, sleep, stress management, positive psychology, and social connections. I can't wait to connect with you and help you to truly optimize your health once and for all.